Hey everyone, today we're excited to have a wonderful guest speaker and that we can talk about one of my big passions, which is about anti-aging and how you age throughout the process. This is Morgan Wood, and he's a trainer at Anytime Fitness. He's in Seguin and New Braunfels, and one of his specialty is trying to work with seniors to increase their range of motion, flexibility, and also strength training. So welcome, Morgan.
Thank you for having me, Dr. Pack. Really appreciate getting to come onto the podcast here and talk about the benefits of exercise in older adults.
Yeah.
It's been a big area of study, especially in the academic world, where we're starting to see that push in society towards more physical activity. It's older adults, just as everyone, benefit very, very much from exercise. Uh, Strength training is a big piece of kind of how people get to live. If you don't have the muscle mass to support the activities you like doing, eventually you don't get to do them anymore.
All right.
And that's why I enjoy working with older adults. It's this opportunity to maintain a lifestyle that otherwise you don't get to.
Yeah, I
Uh,
agree. I mean, one of the big things that topics I talk to my patients about is, what do you want from now, and what does your life look like 5 years from now, 10 years from now? And I actually have them close their eyes and envision. And one of the big pitfalls for me in the geriatric world is falls. It's an absolute nightmare.
Absolutely.
Fall is one of the leading causes of morbidity and mortality in seniors. And what you do is extremely important for them because if you don't build your core, obviously it's inversely relation to you know, how susceptible you are to falling. So can you talk about that?
Yeah, we see a lot in research showing that leg strength and core stability are highly related to those fall incidents,
Hmm.
which is why when training older adults, we want to make sure there is some of that leg activation, squat motions, leg presses, things to help build up the quadriceps and the hamstrings to support daily movement, as well as core stability, because as some individuals get older, they start to round their backs
Hmm.
more. And with that, they're more likely to fall one way or the other.
Hmm.
Um,
Yeah, posture is really important. That's a good point. I talk to especially the ladies, these nice little ladies, and they have that round form and their head going forward. And so posture it's a really good sign. It's a big tell that tells me that their core is really weak. It's so important to do that. But also, we talk about physics a lot. There's a lot of physics that's involved in aging, and we talk about one of the most powerful forces in the universe, which is gravity. And I tell them, I said, look, what's happening to gravity as soon as you're born is you're compressing,
mhm.
right? Gravity is compressing on you the whole time. And so one of the things that I talk about with them is kind of funny is we'll take an old photo and say, okay, how tall were you? And then how tall are you now? And so, that kind of connects the dots that like, oh my gosh, you are being compressed. So, one of the things you talked about was flexibility and stretching is that, there's muscle atrophy,
Yeah,
right? And also muscle contraction and ligament and tendon contraction. And so as those things contract, you're much more prone to injury, right?
yes, sir.
So can you talk about that?
Yeah, there's actually a big benefit to strength training in terms of maintaining that muscle mass, but also with bone density, where we see a lot of older adults, they start to
Mm-hmm.
lose that bone mass. Strength training triggers an autophagic response,
Mm-hmm.
which is basically the body starts rebuilding itself, especially damaged tissue. Um, when we're looking at mobility, the ability, just trying to keep range of motion as we age. We want to make sure that our muscles maintain that elasticity, our tendons aren't overstrained, and really through that, we need to promote blood flow to get the nutrients to
Right.
those areas.
Yeah, I think one of the biggest misconceptions that people have is like, well, I have to go to the gym, and nothing could be further from the truth. All the great trainers and therapists that I know is that they give them exercises and routines that they can do at home. And you don't need to have heavy gym equipment all the time to do that, right?
No, you don't even need to have a gym to do it every time. Uh, Walmart sells resistance bands that are
Hmm.
great for at home exercise. But the big idea with exercise is how do we make it fun? Exercise doesn't have to be this dreading, oh, I've got to go to the gym and get on a treadmill or pick up a weight. You can dance. Tai Chi has been shown in older adults to
Hmm.
help a lot with joint mobility.
Hmm.
Uh, even dancing. I think
Yeah.
there's more ways to make exercise fun than strictly weightlifting.
Yeah, I totally agree. I mean, you do have to make fun because life is too short not to have fun. So part of that is the switch I call. One of the most common questions I get from patients is, "Doc, I'm here and I hear all this stuff online about anti-aging." So every to me, I always joke about that. Everybody wants the Ponce de Leon serum, whether it's testosterone or growth hormone or this, whatever's advertised. And I try to tell them, I said, look. The reality is, real anti-aging, it's a mindset. And I believe that. It's a mindset. Is that, you know what? Even though I'm 70, I feel like I'm 40, right? And part of that also is, and they don't like this, but it's true, if you want to age well, it takes work. Okay. If you just want to sit at home eating bonbons, watching TV, you're not going to age well. That's just the reality. And I'm sure you agree with that, right?
Absolutely. There's a lot of confidence that comes from weightlifting. Research has showed that in terms of mental health, it's entirely beneficial. We're seeing decreased rates of depression
Hmm.
and anxiety in older adults. Movement is the basis of a lot of older adults' social lives, and to be able to maintain that not only maintains a social life, they're getting to move around and maintain that independence.
Yeah, independence is a really important word. If you don't know, like one of my hardest discussions I dread is whenever I have to have a discussion about taking away their driver's license because they see that as like the end to their independence, but they totally forget about that term, mobility. So your ability to move around and actually go wherever you want to go, that relates to independence, right? And I couldn't agree with you more. If you look at the studies, what happened when those seniors were locked down during COVID, oh my gosh, their mental health went straight down the hill. And part of that was multitude of reasons. Number one is obviously they were isolated. But the other thing was exactly what you said. They didn't exercise. They sat at home. And that was the worst thing they could have done. And so it's really important, even if you just get up in the morning to go outside, feel the fresh air, walk your dog. That's a good way to start. But, moving around, like what Morgan was talking about is absolutely important, right?
Yes, sir. It's every little bit of movement you do is only going to benefit you. The worst thing that can happen is you live a lifestyle that you're not moving. Uh, the American College of Sports Medicine recommends for the average adult to get about 150 minutes of moderate intensity
Mm,
exercise, cardiovascular exercise throughout the week, along with 2 days of strength training.
mm,
They don't have to be strictly those things, but maintaining that little bit of exercise is kind of what helps you live longer.
right. And it's not only, everyone I think understands cardiovascular exercise. They talk about that all the time. And of course, especially with osteoporosis, we're worried about, your bones thinning. I'm glad you brought that up. It's a really, really important feature. If you don't know, look up osteoporosis. It's actually a deadly disease. And so I take that very seriously with my seniors. But the other part is that besides strength training and cardiovascular, another important aspect is flexibility. The more flexible you are and greater range of motion you have as you age, it's inversely proportional to injury. So that's another area that I talk to my patients a lot about is like you really need to work on being more limber, instead of being stiff.
Absolutely. In the cases where you're less mobile, you have less of that range of motion, you're more likely to strain something
Hmm.
if you fall, if you trip, if you have to catch yourself. You're going to move a muscle in a way that it's not used to moving, more likely to cause injury.
Yeah. So that's what we're about. As part of one of the things that's really important that we can't it's you there's really no way around it is as you age, it takes longer to heal from an injury. That's a fact. There's no way around it. You can ask anyone, and I'm sure all of you who out there know what I'm talking about. If you had surgery when you were young and you had surgery when you're old, it's night and day. So the best way to avoid that is not to have an injury in the first place. So prevention is the most important thing. And what Morgan and I are talking about is all these things that you can do. And like I said, you don't have to go to a gym to do this. You can actually do this at home. Is to work on cardiovascular, okay, resistance training, and also range of motion and flexibility. Those are the three hallmarks from a physical standpoint. But I can't emphasize enough what Morgan said is so true, is that when you actually go and work out, it really makes a deep impact in your emotional and mental wellness. And so it all ties together. And I think the bottom line is, and Morgan said it multiple times, is being sedentary is the worst thing you can be as you age. That is inversely, proportional to how well you'll age. And so that's what we need to talk about is mobility, movement, and the flexibility. Those are the things that is really important as you age.